decided to focus on 4 major aspects for this Mental Health Awareness Month campaign. And one of them was gun lock distribution in partnership with the VA. I want to ask Wendy, can you share a little bit about your experience of collaborating with multi-sector stakeholders in the Vibrant Hawaii Core team?
I work at the VA, specifically in suicide prevention as a community engagement and partnership coordinator. So when I contacted Janice, I think it was like February, was our first meeting. She's the first person that I've come across who has been willing to tackle this gun lock project, essentially. It's a topic that often people are kind of put off by because it can seem like we're either talking about political things like gun control, or we're talking about just topics of guns can be difficult conversations for people. So the process just felt very easy. It worked very smoothly. We were all identified what area we would like to take on of the 4 areas so that we could kind of determine who was going to be taking, a lead in each area so that we could all hold each other accountable for the work that we're doing. The weekly check-ins just really allowed us to be able to make that weekly progress so that we could report back and say, this is what I found out. I think that weekly check-in just helped push our work. So when I thought about that time frame, I'm like, wow, from the first time we met until we had this project beginning of May, that was less than 90 days. That was an amazingly short amount of time from initially thinking about something to putting it to action. So I was really impressed with just that in itself.
Mahalo, I'm Dawn Regoyi. It's a privilege to be a part of this particular project. This is our Community Social Service Navigator program. A couple of quick number updates. Our outreach was also in sync with Mental Health Awareness Month. We included therapists, social workers, any sort of mental health providers, but we also expanded that definition out to also include anything and everything that encompasses our health and well-being. So we know that things like going to the beach, being outside, going to the park, hiking trails, outdoor spaces, those types of things are all important to our mental healthiness. So in the time that we have had the Navigator program since last September, we have done 229 outreach events, reaching an estimated 41,114 people. Our team has also completed 747 direct navigations to applications. Also wanted to go and have an opportunity to have some of our navigators who have joined us today to go and share some mana'o. I'm going to stop share my screen and then turn this over to the navigators. Mahalo.
I call myself and my fellow navigators human hubs. Instead of being a physical place, like a resilience hub would be, we are the embodiment of all of these different services wrapped into one person. And so all of my fellow navigators were either already people in their communities who were doing this work and serving in this role, or have stepped into this work and become this person that their fellow community members can look to for guidance and connection. The more I do this work, the more rewards I get, the more I feel empowered, the more I feel uplifted, and the more confident I feel in continuing to help and serve my community. So I'm so grateful for the opportunity to do this work and hopefully continue to do this work in some sort of various form or another.
So I originally come from Puna. And so knowing the people and the situations out there kind of drew me back home, of course. And if you know your community, you know the kind of struggles in that specific community. And that's why I wanted to go back home, because people out there, they either don't know, they don't have access to resources such as, social media. So people really are trustworthy of you. And I think it had a lot to do with me and my family coming from the specific community. So it was nice for me to go out, and I felt like there's a lot of people that need help out in Puna. It definitely was a very good experience giving back to the community that I come from.
I am grateful I got to help my two communities. I feel like I made a difference, even just with the outreaches and the marketing strategies. Just getting to know that more and more, you understand the situation. With the help of all our other fellow navigators, and whenever I have a question about something, we email each other, and we just have this great gateway to each other. So I'm so grateful to be part of this program. And yes, I think that we all have the ability to make our communities a better place.
I've been really excited to virtually lead the mental health first aid trainings for our community. I'd also like to invite Jasmine to kind of share a little bit about her experience. So Jasmine attended the most recent mental health first aid training.
I thought the workshop was incredible. I thought that all of the information that was presented really just was about improving our empathy in a lot of ways, being able to show up with whomever it may be, and just be a listening ear and able to hold space for whatever that person may be going through. My biggest takeaway was just that I don't need to have the answers for people, but I can still just hold the space and use language that lets them feel heard. Things that were typically taught, we were kind of shown in the training kind of that some of those things aren't helpful, that sometimes as opposed to showing that you have a similar story and talking and taking up the space, it's better to just hold the space for the other person. And I think it was a good just reminder, because our natural instinct a lot of the times as empaths is to like share how we can empathize with what the person's going through and maybe share our own stories, but just that it's important to kind of listen and hold space. And I actually found it really helpful because a friend of mine's child was going through a mental health crisis, and I was kind of able to hold space for the mother who was kind of beating herself up about what her child was going through, and really just letting her know that I was an open space for her to come and share what she was feeling, and also be able to kind of help her not hold on to everything that she was taking on as a parent in that situation. And so I found myself kind of referring back to some of the pieces from our training, just really appreciate the training and think that it would be helpful for anyone if you are going through crisis, even yourself, to be able to find language for what you need from other people is another thing that I think it would be helpful for. So, yeah.